Yes.
at the beginning of this class. You might see something now that we're saying that we are live, so don't worry about that. We're going to get started. I'm very confused actually as to where everything is. Okay, right, so let's start. Yeah, we're on YouTube and I'm now recording the class. Here we go. Okay, so this is OET Reading. We're going to look at part A for 2 days. This is the way I always do it. So today we'll focus just on step 1 of the normal technique that people use. And then tomorrow we'll look at step 2. I'm here in class with a number of different people. Guys, can you all say hello?
Hello.
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 Hello. Hello.
Hi.
Hello.
All right, so we're going to start with a bit of format. Just it's very easy, but we'll review the format of the test. Then we're going to look at technique overview. So what do you have to do in reading part A and how does it work? And finally, most important thing is we're going to practice finding keywords and main ideas. Okay, because this is really important. So this is what we're doing. I'm going to start with Khalida. If you could say hello, Khalida.
Hello.
So some very simple questions, Khalida. How much time do we have in part A?
15 minutes.
Is she right, guys? 15 minutes?
Yes.
No.
Yes.
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 15 minutes. Khalida, how many questions?
20 questions.
20 questions. And again, I think you guys will all agree that's correct.
Yeah.
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 Does anyone think it's 20?
Yes.
Is anyone thinking 24 now? That's listening. That's listening. So it's 20 questions. And I suppose how many texts are there?
Four.
There's always 4 texts. And I suppose they are testing. Alexi, what are they testing us on? What type of reading?
Details.
Yeah, I would say reading for details.
Yes.
So reading for details. Also, what's called skimming and scanning. Alexi, do you know what that means, skimming and scanning? Does anyone here know?
Yeah.
What is skimming? Anyone? What is skimming?
Read for line.
Quick.
To read it quickly. Actually.
Reading fast.
Quick.
Read for main
Short.
idea. To skim is just to read for the main idea quickly. Like, oh, what's this about? What's scanning then? Anyone?
Keywords.
Find
Or
find out
detail.
the words.
Yeah,
Keywords.
finding specific words. So reading for detail, I suppose, right? So I guess we could just say finding words. Okay. So I guess it's like this. Okay. Does anyone have any doubts or worries about the format of the test? Like, is anyone worried about what pen they should use or anything like that? The basics. Say hello if you are. Okay, so I think we all know what this test is like. All right, I hope so. Let's think about the technique then. We've done format, but let's think about now technique, because this is where it becomes more interesting. Okay. So let's say that here, it doesn't matter. I know this is very small, but this is just an example. Okay. We're not going to do this test. It's just an example. All right. So here are the 4 texts that you normally see in OET. And then here we have just an example question paper. Okay. One more time. How many questions are there in OET Reading Part A?
20.
20.
Right. So obviously this will continue down like this. Yeah. Okay. Now, what is the first thing, Ismail, if you could say hello? Usually, Ismail, what is the first thing that students do in the test? They've got 15 minutes. What do they do right at the start? Ismail, just Ismail, please. Or
Smiles and job, I think he mentioned.
Farouk, if you want to come in, go on, Farouk.
No, Ismail said I'm in job in work. I can talk, I think.
Okay, no worries. Ismail, so maybe some issues there. Let me ask then Ahmad or Alexi.
I
Yeah. There.
Ahmad, Abigail as well. What do we do first?
Yes,
Read the
we read the text.
Yeah, okay. So this is 99% of all OET students they'll read the texts. Okay. And that is officially what you should do. According to OET, you should not immediately look at the questions. Okay, so that's easy. What is step 2 then? What is step 2? Anyone? Anyone?
Answering questions.
Answer the question.
Answer.
questions.
So far, this is very simple, isn't it? Step 1, you read the text. Step 2, you answer the questions. Now, Hussein, if you could say hello, or Daniela.
Hello.
Hey, Hussein. What's very important is how long you should spend on step 1. So Hussein, what do you think? How long should I spend here? Time.
It depends on this if it has signpost or it has no signpost.
Okay, I know what you mean, but in general, overall,
2 minutes.
2 minutes.
2 minutes.
approximately 2 minutes.
Approximately.
Let's say 2 minutes max, right? So
Yeah.
I would say 90 to 120 seconds. Okay, so 1.5 or 2 minutes. No more, but I think not less than 90 seconds, because you really need to read these texts properly in the correct way. Okay, so how much time then do we have for step 2, guys? How much time for step 2?
13 minutes left.
13 minutes, or if it's 90 seconds, it would be 13.5.
More than, yeah.
Okay. All right, so that's the timings. Now, today, I only want to focus on step 1. So we're not going to talk about step 2. That will be tomorrow. Okay. We're just going to focus on this. And there's 2 things, actually 3 things that we do here. Okay. But the first point I want to make is this. Why am I reading the texts? Zainal, could you say hello, Zainal? Or Shashina?
Hello.
Why am I reading them? Why am I reading the texts?
For main ideas.
Okay, so I'm reading for main ideas. Why do I want main ideas?
Because
To answer the questions.
It's separate them from
How do main ideas help me answer the question? How? Someone already said
Separate.
the answer.
Classification.
Yeah.
We can.
Sorry, Nisha. Zainal is not answering, and you guys are answering for him. That's good, but give him a chance, okay? So Zainal, did you hear people saying to separate? Did you hear them say that?
Yes. Yes.
Right? So to separate the texts, that's why we are reading, okay? We need to see what is different about them, okay? This might seem like a very simple point, but this is actually very, very, very important. We are not interested in things that are the same. We only want things that are different, okay? So how do we separate? Ways to separate. I think there are 3 main ways to separate texts from each other, to differentiate them, okay? One way is, everyone?
Main idea.
Read the title.
Main idea.
Main idea.
Main idea, yeah.
So for example, just to make this very simple, if I know that this one is about medication, main idea, and I know that this one is about symptoms, that's main idea separation, right? So again, very simple idea, but this is very important. If my question says, what should you give to a patient? Should you give, or what should you prescribe to a patient?
Medication.
I'm going here, right? So main ideas is one of the most important, in fact, it's the most important way to separate texts, okay? So we must find the main idea, we must. Is there another way to separate texts? Anyone? Is there another way?
Read the first line.
Ah, no, well, that's a way to find the main idea. I'm saying another way to separate the text, not read first
Is it-
line. That
Thematic?
Keyword.
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 Keywords.
Okay, keywords. So keywords is not main idea. Keywords, we are going to, what is this? What am I doing here?
You scanning something.
Yeah, scanning.
Underline.
Oh,
Underline and
Scanning, yes.
Underline.
Underline the
We say
keyword.
underline, okay? So with keywords, we're not getting the main idea like this. We are just underlining words that we think are important, okay? Finally, there's one more way, which I will not teach this week, but you can watch the video course if you want to see on the video course. What's the other way?
Function.
You can also look at the function of the text and think about what is it doing, okay? But we won't look at this today because we don't have time, all right? So I'm going to focus on main idea and keywords only today, all right? And in this class, we're going to practice finding main ideas and practice finding keywords, okay? But what you need to understand is that the reason why we do this is we want to separate the texts, okay? All right, I'll take a few questions quickly and then we'll go into more detail. Does anyone have any? Put your hand up. Siham, yes, please.
I have one important question. Are the questions are in order, chronological order with the text?
They are. Well, hold on a second. What do you mean in chronological order?
I mean, the
Oh.
first question, I have to look at text one,
Right. So
Fine.
no, they are not. Yeah.
Oh, no, okay.
Yeah, good question. The answer can be anywhere, absolutely anywhere. Okay. But they're very short, Siham, so you don't worry because it's not like that anyway. You just tomorrow you will see, I'll teach you tomorrow how to find the answer really quickly.
Unfortunately, I work tomorrow, so I will not be in live session.
Okay, well, watch the video. You can still do the activities because I always give time for people to think. Okay, so you can still watch the video, saying exactly the same experience. All right. But we're just going to focus on this one first, guys, because I think a lot of students struggle to do this. People find this very difficult, especially finding the main idea. This is difficult. What will happen if I don't get the main ideas? What's going to happen?
We cannot find the answer actually later on.
It's
We will
much
struggle.
much more slowly, isn't it, if I don't have the main ideas? Because what? How many texts do I need to read if I don't have the main ideas?
All of them.
4. Each time I'm reading 4. But if I know the main ideas very well, very
Saves
often
your
I
time.
will read only 1 text or maybe 2, but not 4. Okay, so this is really, really important. Let's go into more detail about it. All right, so main idea. How do I get the main idea in a text? Burhan, can you say hello? How
hello.
do I get the main idea of an OET, right? An OET text.
We can read the headlines.
The headlines, yeah?
Yeah.
By headline, you mean like heading, usually heading, yeah? So is that right, guys? Can we use the heading?
Yeah.
Yeah.
Yes.
Of course,
Yes.
of course, right? So
Yes, we can.
I know this is, it doesn't matter. This is just an example, but can you guys see here? There is a heading here.
Yeah.
Yeah. Yes.
If you have that, then that is the main idea. Okay. What if I have 2 headings? What if I have 2? Can there be 2 main ideas?
Yeah.
Sometimes we have. Yes.
Of course, right? You can have 2 main ideas. You can have 3 main ideas if you want. Okay. So heading is probably the most important. Was that Burhan? Did you say that?
Yes, Alan.
What happens, Burhan? What happens when there is no heading?
We must read 4 sentences.
Okay, read the first sentence. Okay, read the first sentence. Does everyone agree here that we can read the first sentence to get the main idea?
Yes.
Yeah.
Yeah.
Yes.
Does it always work though?
Not really.
Not
Not
always.
right? But it's one thing. It's one thing we can definitely try. We can try it. Okay. So that's one thing we can do. 1 second, guys. What else can I do? I can read the first sentence here, right? What else can I do?
Repeated
Find
words.
repeated word.
Bullet points.
So let me just show you. So that's first line. Okay. You can look for repeated words.
Thematic.
Repeated words. Let's just focus on repeated words. Farouk, what do you mean by repeated words? What does that mean?
Those words which are repeated in the middle of this task.
Oh, it might be the
Frequent.
same
For example,
word.
yeah, I
Repeat,
can read this, but
Just an example. I know it's
Yeah.
but you get the idea, guys. We're finding repeated words, okay?
tetanus, like
You see the same word. You see the same word many times, okay? What's another thing that we can do? What's another thing?
dramatic words.
Bullet points.
What's from the same group?
Thematic words, yeah. And Mandira, what is thematic words?
Same group. Oh, sorry.
like a similar.
Yeah, same group, similar. Okay. So I always give this example, but it's very easy when you realize. So guys, what is the theme of these words now? Okay. Table, chair, sofa.
Furniture.
Furniture.
Okay. What is the theme? What is the theme of these words now? Dog, cat, fish.
Animal.
Animals.
Okay. What is the theme? What
Pet
is the theme of this one? This one. Car, train, bicycle.
Transportation method.
Okay. What is the theme of this one? Cough, headache, sore.
Symptoms.
Symptoms.
So sometimes we can see thematic words in a text, right? Again, this doesn't matter. It's just an example. So maybe I see all of these words. They're different, but they have the same theme. What does theme mean, guys? What does theme mean?
Group in the same group.
Group of same category.
I use these three techniques when I don't have a heading. That's what I do. Okay. You guys can try to do this as well. Is there any other way to get the main idea? I cannot really think of any other ways to do it. Go on. Irina?
Bracket.
Practice.
No, practice is the keywords.
Oh, it's like the keyword. Yeah.
Well, that would be more for keywords, okay? So let's talk about keywords as well now. Sorry about this. Let's talk about keywords. So number one, we're saying we can find the main idea. Okay, that's main idea. Let's look at keywords now. Okay, so keywords. What is a keyword? Mandira, can you say hello?
Hi. Hello.
What is a
Keywords.
keyword?
I cannot explain exactly, but keywords like some are in the brackets and some are bold later and
So
some are capitals.
Can you see unique word?
A unique word is a keyword. Maybe that's more like step 2. Siham, what is a keyword? You can see we are underlining these.
So, for example, numbers, names, brackets.
Or gives the
Fantastic. You've been watching the videos, I hope. Yeah, great. So look,
Sometimes we think that might be asked. Like
it's specific words.
Yeah, it tells you where inside the text.
They will ask about, right? So just imagine, for example, if we see here 19%, do you think that they might ask you about that?
Yes.
Absolutely,
Yeah,
right?
could be.
They're going to say, what percentage of people have these symptoms? And you're going to go, oh yeah, text A had a percentage. So we're looking for specific words that they will probably ask us about. Okay. So as she said, Siham said, we want numbers, we want brackets, capital letters. What else?
Yeah.
Footnotes.
Well, I'll talk about that in a minute. Anything else?
Name.
Names, drugs,
Dates.
maybe dates, right? So that would be numbers again, right? Guys, look, anything suspicious. What does that mean? I love this word, suspicious. What does it mean? Ahmad, can you say hello? Or if we have Daniela, what does it mean, suspicious?
Weird.
Weird. Can anyone, Siham, can you tell us
Yeah.
what does suspicious
Yeah, suspicious. I mean, it might be in the question. They ask for it.
Exactly, right? This is what she's saying, guys. It just means that they might ask us about it, right? So you see 19%, that is suspicious. So anything, right, that it looks like they might ask, okay? But how many words should I underline? I cannot underline 20 words. How many?
4 to 5.
Maybe 4 to 5.
4 to 5.
So guys, don't underline any more than 4 or 5 words. You will not remember more than 4 or 5 words. Okay? So guys, just to summarize here, in step one, you are reading the texts from 90 to 120 seconds. You are trying to find the main idea, and you can do that from first line, from repeated words, or from thematic words. You are also looking for key words. Key words can be numbers, things in brackets, capital letters, names, okay? And you're going to underline those words, all right? Those two things together will separate the texts, okay? So we're going to practice that now for the next 30 minutes. We're going to practice this together, okay? But I'll say again, does anyone have any questions at this stage? Is everyone okay with what I'm saying? For example, go on, Mandira, go on.
So we have to get it done all within 2 minutes.
Maximum 2 minutes, okay? But Mandira, don't think of this as a bad thing. This is saving you time. Does that make sense?
But
if you don't,
yeah, but it's quite tough to manage the time, isn't it?
It is very, very, very tough. That's why I'm giving you very specific timings here. Okay. But if you don't do this, this will take longer. So you're going to get this time back. Okay. By the way, guys, does everyone know what we mean by brackets? I didn't check. What is brackets?
Yeah.
Baja, what is brackets?
Inside of brackets, so the two, I don't know how to explain it.
Like this, guys. Can everyone see this here?
Yeah, that's right. Yeah.
Brackets. Okay. Let's practice. You can see now what's happening when we practice. So I'm going to show you some texts. All of the texts are about asthma. Okay. So all texts are about asthma. So don't tell me the main idea is asthma, right? Because all texts are about asthma. We don't want that. You're going to find the main idea of each text. Is everyone ready?
Yes.
Yeah.
Okay. And I'm going to give you only 20 seconds. And I'm going to ask a specific person after 20 seconds to tell me what the main idea is. Okay. And remember, to get the main idea, you're going to read the first sentence, look for repeated words, and look for thematic words, words of the same group. Okay. So here we go. I'll count down from 3. Okay. 3, 2, 1. Here is the first text. Please keep microphones off. I'm going to ask one individual person here. That was 10 seconds. You see, you can get it in this time. You can easily do it. Okay, I'm going to ask Navira if it's okay, or Najibullah.
Yes, Alan, it is the management of asthma.
Okay, and how did you get the answer here? What is it that got you the answer?
In the very first paragraph, and also the subheadings of medication compliance, asthma action plan, triggers identification, and
Yeah.
all these. And in the first two lines, there are some tips, the key tips for asthma management,
Yeah.
and also how we can effectively manage asthma in daily life or in spending a healthy life.
Yeah.
To lead
Now,
a
as you
healthy
mentioned,
life.
Buller, you're underlining this. This was not here before, so you can't. That's not the answer for how you did it. This one is very easy, okay. But I made this to show you something really good. Look, what do we call these?
Bullet points or
Bullet
something.
points.
Bullet point.
Do we see that in OET very often in Part A?
Yeah.
Yes.
So whenever I see this, that means all of these things have the same theme. That means everything there is thematic, okay? And usually, if you see bullet points, all you need to do is read the sentence before here. If you read that, you can see the theme of all of these. Does that make sense, everyone?
Yeah.
So that's one way you can read the first line. I don't think here the first line does not tell you the main idea at all. You can see thematic words. This is all thematic or management. Is there any repeated words here? Is the word is managing repeated? I don't know.
Management, managing.
Management. Any more?
Lifestyle.
Has to be exactly the same as managing.
Managing, yeah.
And
Managing. Okay, so in this example, it's thematic words that gives you the main idea. Does that make sense, guys? You see the theme of these bullet points, or you can just read this sentence here, okay? First line, not giving me the main idea, okay? So remember, you have to use all of these together. You cannot only use one and get the main idea. You have to try all three together, okay? That was a fairly easy one. Is everyone ready for the next one?
Yeah.
Yes.
Lots of these today, okay? So 3, microphones off, please. 3, 2, 1. Just keep microphones off because people are trying to think now. 3, 2, 1, go. Now ask one person. Five, 4, 3, 2, 1. Daniela, can you say hello? Daniela.
Yeah,
What's the main idea?
symptoms.
Okay, how did you get the main idea?
Well, is like detailing a lot of symptoms which you can recognize if you have asthma, like
So
coughing, wheezing.
we have coughing, we have wheezing. Okay, so we have this. This is an example. This is thematic words. We also have the word symptoms here. Anything else? We need more than that.
Medication.
Medication.
We have the word okay, so we have the word repeated symptoms here. Symptoms. Is symptoms repeated more times? So 2.
I think school age children and asthma.
Asthma in children and
Asthma in school
recognizing
age
symptoms in
children.
children.
Okay, so again, what we're seeing is thematic words and we're seeing repeated words. Okay, so coughing, wheezing, as you say, asthma. These are all examples of symptoms, right? So the answer is correct. It is symptoms. Okay, we're going to do another one. Is everyone ready?
Yes.
And I'll start to talk about keywords. In this next one, we can also talk about keywords. So here we go. I'm going to give you only 15 seconds for this one. See, it's not that hard, is it? Now be careful with this one.
Don't
Be careful. Don't say the answer, please. Just wait, because not everyone is the same level. Amir, could you say hello, Amir?
hello, sir.
What is the main idea here?
Sir, allergens.
Allergens. Not quite. Not quite. Almost. Anyone want to tell me what the main idea? Oh, okay, let's have
Cause
Asthma triggers.
Triggers process.
Triggers, asthma triggers.
Triggers.
Yeah.
Someone said triggers. It's not triggers, it's triggers. Triggers. So I think this is the most important one. Okay, so yeah, I'll give you allergen. Actually, that's not bad. That's okay. Because it's not asthma, is it? It's something different. And yes, it is repeated. But I think triggers is important. We have triggers in the first line, don't we? We have triggers in the first line. Any other reason why this is triggers? Is there any other reason why?
Because they mention about pollen, dust, animal.
The bullet points and repeat the word a few times.
We've got pollen, we've got dust mites, we've got
Animal.
got mold. What's the theme of all of these things?
Causes.
Allergens. Actually,
Allergens. Yeah.
allergens and triggers. And again, we can see that here. We can see that.
Group of allergens.
All right. So I've got lots of these. Don't worry, I've got many, and they'll get more difficult. But what about keywords now? If you're going to underline, Mary, if you're going to choose some words to underline, like suspicious words, what would you look at here? Just Mary, guys.
It can be some trees, grace, maybe. Usually they ask us about one missing word.
Yeah.
Saliva.
Saliva, where's that? That sounds like quite a, or maybe ventilation.
Ventilation, yeah. Saliva.
We're just looking for things they might ask us about, guys. So yes, saliva, ventilation. What else, guys, might they ask? Everyone now, what do you think?
Feces.
Feces. Yeah.
Ooh, what? Yeah, feces. Pronunciation feces. So definitely might ask. Could be weeds. Whatever. We're just looking.
Tiny.
Go on.
Sorry, tiny insects.
I can't hear you.
Tiny insects.
Yeah. Okay. And remember, guys, we're just using our. We're looking for things that are suspicious. It can be numbers, brackets, but it can be anything that we think is. Oh, they might ask me a question about that. Okay. All right. I've got lots of these. So ready? Here's the next one. 3, 2, 1, go. I'm gonna ask someone. 5, 4, 3, 2, 1. Khwaja, what's the main idea here, please?
Asthma and childhood.
Now, if I say, so the thing about asthma, right, is that all texts are about asthma. And remember, Khwaja, we said right at the start, we need to separate the texts. So if they are all about asthma, that is not helping me when I answer.
I could manage only to read the first sentence, to be honest. So
Okay. Can anyone help him then? Because I know it's very fast, but I'm just
Management, but repeat it again.
Medication.
Ah, someone said. Abigail, go on.
Medication.
Asthma plan.
No.
Now, that's unusual. Normally
Health education.
we don't normally see this in OET, okay, education, but I wanted to make it difficult for you. Who said education? Who said that? Abigail and one other person. Who said that?
I think it's a part of management.
We can talk about that in a minute, but let's just focus on education. Why?
Education.
I think awareness more than education.
Essential.
Awareness also could be.
Yeah, awareness more than education.
Teacher should.
Aware of,
Yes,
training,
action plan. Seek help.
school hours, teachers. There's so many,
Help.
right?
Emergency plan as well. Response
Exactly.
plan.
Now, guys, look, what this shows us is that thematic words is the most powerful way to get the main idea, okay? Because there's so many thematic words here. Abigail, well done. We can say education. Now, Emal is saying management. So it's possible to have two kind of mixed in together. Go on, Emal. Why did you say management? Is it like this is
a part of management?
Everything is management.
Like management in education, like that?
Yeah.
Yeah. That's okay. You know what I mean? Because we're sort of trying to manage the asthma. So I don't mind that as an answer. But we do need education because
we already have management in the first thing.
Here, right? And remember, what are we trying to do? Everyone.
Separate them.
Differentiate, separate.
So what you don't want, what is very bad, is when two texts have the same main idea. Okay, so you have to decide. Okay, well,
Then management at school.
exactly. So remember, in your exam, if you don't do that, then it will take you longer to find the answers. All right. What about keywords? Again, there's not very many numbers here or brackets, but what do you think should be a keyword? You can underline, use the pen on Zoom, go to the bottom or the top. Just underline, what do we think is a good keyword here? Schools, maybe. Children, teachers, maybe. I think I want something like minimize. That would be good. I think that's the best one, because probably they will ask you something about minimize. Anything else? Look for things that are very unusual things, right?
Emergency response.
Yeah, there you go. Maybe that, right? Who said that? I like this, and I like minimize as well, right?
I said as well.
They're very suspicious, those words. Okay, so you get the idea. Try your best to find words that you think are kind of suspicious, and they will ask you about them. Okay. Are you ready for more? I've got more. I've got many. We're just trying to practice. Okay. Everyone ready?
Yes.
Yes.
Okay, so here we go.
Yes.
All the texts are about heart attacks. All the texts. Okay. So you cannot say heart attack now. 20 seconds. Don't shout out the answer, please. Just wait. You can put your hand up if you think you know. Yeah, that's okay. I'm not going to ask you, though. Siham, can you tell me what is the main idea here, please?
Well, sorry, it was frozen. I have to have a look.
Oh, it's okay. Everyone,
It was symptoms.
Common symptoms.
Sign and symptoms. Yeah, symptoms, heart attack symptoms.
Farouk,
Definition as well.
So let's have Farouk first. So Farouk, you underlined this, didn't you? Farouk, could you put your microphone on? Or was that a teak? Sorry, a teak. Remember what I said. If you see this here, and what do we call these? What's this?
Colon.
Colon, right? So normally we say things like, I went to the shop and bought apples, bread, milk, fish. What does the colon do? What does the colon tell me?
Explains actually what's coming up.
Of something.
It's kind of like a list. And a list.
Yeah, there are different things.
A
More
list
than ones.
Well, it's a sign of thematic words coming. Okay. So again, we know that all this must be thematic words, and of course it's symptoms, right? So we have symptoms here. Can we have more than one main idea? Possible.
Yes.
Yeah. Yes.
But sometimes you have to check this as well. Let's just, for example, let's look here. Is this about symptoms?
No.
Are you sure? One, two repeated words.
Yeah, common symptoms.
Signs as well. I think it's also about symptoms. So the answer here is
It's like an
symptoms, I think. Okay. Thematic words is helpful here. The first line is not helpful, but repeated words are helpful. Okay. Yeah, this is something extra, but it's basically symptoms here. What about keywords, Abigail?
Yes.
If you were in the exam and you had to underline some words, what would you underline? What would you guess?
It's crucial.
Ooh, where's that? Where's crucial?
In the first paragraph, yeah.
Crucial. Here.
Yeah.
Because that means very important, right? Okay. Other things we might want is body parts here. I think that's good. Profuse sweating is good. An unusual symptom or you don't normally...
Unexplained fatigue.
Okay, so again, you're just trying to say, okay, what is suspicious here? What they might ask me a question. Sevinch, yeah, right?
Yeah.
So the question might be, you know, what can be mistaken? What can be mistaken, right? That might be the question. Okay, next one. I'm going to give you guys, again, only 15 seconds on the next one. 3, 2, 1. 15 seconds. Okay, Lucinda, you're already here. Go on, Lucinda. What is the main idea here?
I think it's diagnose.
Okay, you're very fast there. What is it that got you to diagnose?
Well, it's repeated several times. Diagnose, the word diagnose. And down to.
For.
Yes, and then again.
Diagnostic criteria.
Is she right? Is she right? It's got to be diagnosed, hasn't it? It's got to be diagnosed.
Yes.
Okay, and what about keywords? There's a very, very clear keyword now. What is it?
Criteria.
Criteria.
This.
ACG.
Why is that a good keyword?
It's capital.
It's capital and
Letters and it's
brackets.
in brackets, capital letters and in brackets. So there's a very good chance that they're going to ask you about this. Okay. So we have lots and lots of thematic words in this one. Diagnose. These are all real texts I've taken this from. Okay. So again, I'm going to do the next one. 3, 2, 1. Again, try to find the main idea. Maybe I'm giving you too much time.
Medications.
Treatment.
Just don't try not to say. Okay. Just think about it, guys. It might not be what she said. It could be something else. 3, 2, 1. Amir, or we can try Hasina. Olga.
Medication.
So Hasina, you guys all agree it was medication, and that was very fast. Siham, well done. Why are we saying medication? Because
in the second paragraph, they're all medications.
so we have many thematic words again, right? These are all examples of medications. Also, we have medication as the first sentence. Now, when I say read the first sentence, do we read the first sentence here or also here?
Paragraph. First line of each paragraph.
For each paragraph, you can quickly scan the first sentence, okay? So we have medications in para 1 repeated, para 2, and we have all these thematic words here. The answer, it must be medication, right? Also medication is here as well. Well done for getting that really quickly. Again, 3, 2, 1, text D. It's all heart attacks, so don't tell me heart attacks. Put your hand up when you have the answer. Ooh, very fast. So, Olga, what's the main idea here?
It is management.
Don't think it's management. No. Nice try, though. Siham, what do you think the main
It's
idea
the equipment that they use.
Equipment.
How did you get that?
Well, first of all, the capital letters AKG, and then I went straight away to IV, intravenous, and then oxygen backwards.
There we go. This is equipment. So there is some repeated word. The word equipment,
Yeah, items also mentioned here.
So just to break that down, first line, yes, we have equipment. Then we have thematic words again, thematic words, defibrillator, for example, IV. And so, yeah, equipment. Well done. Very fast.
Well, and it's management as well. The equipment is for the management.
Okay, so give me the evidence. If you're going to say management, show me where.
Like the procedure as well, it is for
the word.
management.
Okay, so one word. What else? Give me one other word that's connected to management. Equipment is equipment.
Oxygen therapy as well.
Administration is not management. Assess. Well, assessment is assessment. It's not management. Maybe management. No, not really. There's not enough. Okay, it's not enough for management here. Okay. Okay, I've got more, but before I do, again, keywords. Where are the keywords? Come on, easy. Underline them.
The brackets again.
Same again, yeah. And also, is there anything that's suspicious here? I'm thinking abnormalities is might be good.
Yeah, catheterization.
Catheterization is good. Anything
Angioplasty.
using anything with medical jargon like this, medical words. Yes. Okay, good. Okay. So look, some of you can do this really fast. You don't need 30 seconds necessarily, right? So you do have the time to do this. Remember, in the exam, should you write down the main idea in the exam?
Yes.
Yeah, write it down on the side, okay? Underline. So you're underlining and just writing down 1 or 2 words here, okay? Make like a menu. It's like a menu in a restaurant for the texts. It's very, very helpful later on when you start to get stressed, if you know what the main ideas are, okay? I think I have more. I've got more. I've got a crazy one. Are you ready? You guys are all too good. Let's see if you can do
Yes.
Yes.
L.
Okay. This looks horrible. It looks horrible, but actually it's not so bad. Not so bad. You should already have a good idea of what this is about. Najibullah.
Symptom.
Yes.
Symptoms.
Right?
Sinus
It's at least this, at least, but just you need to check what's that about. Is there something more here? Right? We know probably this is going to be
Influenza tips of influenza.
Flu. Yeah,
Well,
presentation and complication.
Symptoms and complications.
Symptoms and complications, maybe.
Definition.
Prevention.
Presentation.
Now, this is one of I made this to show you something. This is very important. Now, when I say find the main idea, can there be more than one main idea?
Yes.
Yes. Do we need to find all of the main ideas? Do we have time? Well, if
we have.
if you can, yes. But what I always say is get as many as you can. Maybe you can get this one and this one, but maybe you cannot find this one. Just for example, imagine you cannot find this one. What do you do if you cannot find one part? For example, here, imagine I don't know what it is. What shall I do?
Skip.
Just skip it.
Skip it.
Read again and skip.
Well, what I do is I focus my keywords here. Right? I'm going to do more keywords from the thing that I don't know. Does that make sense? So, for example, I know this is symptoms. What is this?
Types.
Yeah, concept.
Presentation.
Like a description?
Description. Yes.
So I've got description and I've got symptoms here. And for example, if you don't know what this is, you can just focus your keywords here, right? So many keywords, 1, 2, 3, 4, all my keywords are here because I don't know what the main idea is. Okay, that's one technique you can use to help yourself. Tugba, you've got your hand up. Go on, Tugba. Or was that from earlier on?
Earlier, yeah, sorry.
Now, we're going to run over slightly because, yeah. Shall we do a real one? I just made those to help you practice. Shall we do a real one?
Yes.
Yes, please.
Okay, so we're going to do a real one, and then tomorrow we will finish this. We will finish this test tomorrow. Okay, we can do the first 7 questions today because the first 7 are basically main idea questions. Okay, so again, I'm going to really put you guys under time pressure. Is everyone ready?
Yes.
Yes.
So 3, 2, 1, go. Here's the first one. Oops. Please don't say the answer. Just wait, please. I'm going to choose one person. Just wait. Don't speak, anyone, please. 3, 2, 1. Mariana. What is this about, please, Mariana?
It is about arthritis.
Okay, all of them are about arthritis, so we're not
Okay.
differentiating the text. We need to have something more specific. What's the theme of this?
It is the area which is affecting the
Area affected.
yeah the symptoms of the
What do we think, guys? Just focusing on this, everyone. What is this? All shout out. What do we think this is? Symptoms?
Symptoms.
Symptoms. Yeah.
Yeah, symptoms.
See if this is right. Oh, this just says reactive arthritis. This doesn't help us at all. So this is definitely symptoms. That is symptoms. Okay.
Second
What's
sentence.
that? What's
Second
this?
line. Symptom.
I would say this is symptoms, and this one is, what's the other one?
Description.
Yeah, description.
Description.
Well, sometimes I call this definition. Or
Yeah,
we can call it
definition is better.
description. It doesn't really matter. So in the exam, guys, you're going to write, I would write down, right? Does everyone agree this is symptoms? Or is this symptoms? Occurs 2 to 4 weeks after to, yeah, onset.
Yeah, it's a symptom.
Yeah, the symptoms.
Yeah, it is symptoms.
So symptoms and maybe development. Symptoms, development. And we have description of or definition. Description of the condition. Okay. So I would write that down in your exam. You write that down, and now you're underlining keywords. So what are the keywords, guys? Underline keywords now.
Weeks are important, actually.
Isra, you say onset. Why did you choose that one? Very interesting. Why onset?
Yes, the onset is the same of development.
Yeah, and it means beginning as well, doesn't it? So
Yes.
what are the symptoms at the beginning? Right? Okay, good. 6 joints is good. This is very good. Who did this one in yellow? Yeah, they might ask. Things in brackets, mouth ulcers, dystrophic changes as well here. Very good. Okay. How many keywords should we underline?
5.
4 to 5.
4 to 5.
Depends on your memory. How good is your memory? Maybe 6. It's up to you.
My
Five is enough,
memory
I think.
100 words.
But there are 4 texts, so you need to be careful. I think 4 or 5. Okay, next one. Ready? 3, 2, 1. Just get it in quickly as you can. Put your hand up when you have the answer. Ooh, very fast. Put your hand up when you think you have it. It's easy, isn't it? This one's really easy. So, can I speak to Gozde? What's the answer here? What's the main idea?
A main idea. A main idea is test types.
Yeah, of course. So remember, if we have a heading, we can just write that down. That's the main idea. I think officially this is investigations, right? I think this was probably investigations. If I delete it now, yeah. But it's the same. That's the same idea. Test is an investigation. It's the same thing. Okay, what about keywords then? Can I ask Ahmad? What would you underline in terms of keywords here? Just Ahmad, please, guys. What's important here?
Causative organism.
Causative organism is very good. That's actually the answer to one of the questions. Well done. Onset again. We have.
Onset.
What else? Maybe HLA-B27, capital letters.
Maybe X-ray.
Sexually active patients could be good. Yeah, they could definitely ask you about that. Rheumatoid factor. Yeah, there you go. There's
Recently arthritis.
a lot of very suspicious things in this text. A lot. Okay. All right. So again, no more than 4 or 5. Oops, 1 second. Let's do the next one, and I'm going to ask one of you after 10 seconds because you guys are so fast today. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Jamuna, can you say hello? Or Isra, could you say hello?
Hello.
What is it? What's the theme of all these things?
Yes, it's about the management.
Physiotherapy. Yeah.
Treatment.
Is she right, guys? Is this management, do you think?
Medication.
Is it
Medication or
treatment.
medication and the treatment.
We see.
Including
We see.
Management and treatment.
We see. 3, 2, 1. Management. Well done. You said management. I'll talk about this later. Sometimes treatment and management is very, very close together, aren't they? They're almost the same idea, but not quite. Okay, keywords. Yes. DMARDs. Yes. Sulfasazine. All of these things are great keywords, aren't they? Okay. Very suspicious stuff. They're going to ask you. They're going to ask you a question about this. Okay. You guys are doctors and nurses. You can predict what they will ask. Okay. You can definitely do it. Okay. Last one.
But unfortunately, they are not doctor.
Say that again, sir. You're not a doctor.
Unfortunately, they are not doctors.
No. They don't know how that question.
In these texts, the creators. Okay, here's the last one. So 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Microphones off, please. I'm going to ask Ahmad. It's okay, or Gosde.
I think it's medication.
Medication.
Complication.
It's got to be medication. What do we think? Is he right?
Yeah.
Medication.
Yeah.
Here's the thing.
Medication and side effect.
Medication and side effect.
Okay, now, very important here. Here, I'm going to write manage. Okay. If I only write medication, I think there's more. There's more than that.
Side effect.
Side effect.
Medication and side effect.
And so I would say meds.
Dosages.
Dosage. Yeah.
Dosage. Well, that would be medication. In medication, you expect dosage.
Medication side effects.
But I would say side effects, definitely, and maybe
Yes.
indications.
Contraindication.
Indications and side effects.
Just
Yeah, medications.
Okay. So in the exam, this is what you're doing. You're going to write down these simple words. You're going to underline keywords. Again, keywords here, it's very clear, isn't it? We've got numbers. Where are the numbers? Everywhere.
everywhere.
Right. So just choose maybe 1, 2, 3. You cannot do all of them, but just try. Anything else we should be underlining?
Things between brackets.
Sometimes they ask for additional medication here, maybe like if the main medication is not working.
Yeah, no, absolutely. They do that. They actually, I've seen that many times. So
Yeah.
if you see this like alternative medication,
Yeah.
definitely underline that. Okay.
Or the name of the medication, like
Yes. Now we haven't seen it today, but what about footnotes? Amir, can you say hello, sir?
Hello, sir.
What is a footnote? Do you know what that is?
Sir, at the end of the paragraph, there are sometimes a line.
A line, a sentence, yeah?
Yeah.
So for example, it might say like here, oops, guys, for example, a footnote might be like this here, and then here, I love to eat apples on Wednesday, or something more serious. People can get sick, okay? This is called a footnote, all right? What should we do when we see footnotes?
Need to read them.
Some stores.
Read it
Underline.
and consider it.
Underline the word.
Usually there will be a question.
Yeah,
Exactly,
it's
answer
OET gifted for us.
It's
Yes.
very, very suspicious if it's in a footnote.
Yeah.
They're gonna put answers there. And also be careful, a footnote does not need to have the same main idea as the rest of the text.
Yeah, sometimes it's about children dosage.
I could have footnote and talk about symptoms here.
Yeah.
I could have footnote and talk about test type here. Right, so be careful with the footnotes. Now, we didn't have any footnotes today, though. Kwaja, go on.
So sorry, the footnote could belong to any text, yeah? A, B, or
Yeah,
C.
because you know when you're reading medical journals, right? A footnote is just telling you, I want to say something extra about that. So it could say, please note, Manchester United use this. Guys, keep your microphones off if that's okay. We're going to disturb the rest of the class. Okay, we're going to finish this class, but I want to show you how this works now. We have the main ideas here. We wrote them down. We have focused on keywords. let's see if we can do the first 7 questions quite quickly. Because the whole idea of this is that when we start answering, it's better, it's easier. Okay. So is everyone ready to see the questions?
Yes.
Yes, sir.
Yes. Yes.
So when you see them, please don't speak. Just wait. Let's wait for, I'm going to give you 1 minute to read them. Okay. So 3, 2, 1. Here's the questions. Just don't speak for 1 minute and then we'll go slowly through the answers. Just so about this. Okay, so just slowly, I hope you can see that some of these are quite easy now. We can just look at the main ideas and it's actually, some of them is quite clear. For example, yeah, bacteria causing reactive arthritis. Where am I going?
A.
We can just eliminate, we can trust the main ideas and just eliminate the other ones, right? This is causes. Causes will be symptoms and development, right? Okay, what about Hussein? B, non-medical treatment of reactive arthritis. Non-medical.
It is management.
Management. C.
Management. C.
Must be, right? It must be because all of the other ones don't seem to talk about that.
Yes.
Okay, what about number 3? Confirming a diagnosis. Everyone, confirm
A.
diagnosis.
It's
A.
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 B.
S
B.
I.
B this time.
B.
B.
Diagnosis B.
Interesting,
B.
interesting. I thought this was easy. So, do you, to confirm a diagnosis, do you just look at the symptoms and you confirm it? No.
Oh, it
No.
To do a test, right? So the answer must be
B.
B.
That's the word confirm. What does that mean? The word confirm.
To
We're
make sure.
certain, 100% sure.
Evidence.
Make sure. Right, so
Sometimes
usually that would
there's
be-
some types of testing.
Now this one is very hard. I think this one is difficult. Amir, could you say hello? Or Atik, Najibullah?
Hello.
Is it? What do you think this one is?
It's D.
You think D?
D.
Yeah.
To avoid using with certain.
D.
Yeah, side effect.
It is
I think it's
counterindicated that.
Yes.
Could it be any other one?
I said B.
B.
B, right? This one is tricky, and I think you need to double check. You need to go and look because it's possible for more than
It's
one.
What
That will
about
be C.
Yeah,
A?
you can check. You can check. But number 6, conditions associated is very easy. I think conditions associated.
A.
A.
C.
It must be A. It must be, right? The development, the symptoms. Okay, what about 7? How to choose appropriate medication.
D.
D.
B.
D.
This is from before. Ignore that. And what about 8? Eliminating other forms from a diagnosis. Come on.
B.
B.
And B, right? So it's really only this one that you... Is it number 4 that you need to check again? What was number 5? Sorry. Reminder about the correct dosage.
D.
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 Reminder about the correct dosage is, did someone say B?
Maybe D.
That would be test type.
D. It is D.
So what I want to say on this, is trust the main ideas. Trust them. You can usually trust these ideas to make the match. Okay. The only reason why I'm worried about number 4 is that management can sometimes have drugs in, right? And this can be drugs, and this can also involve drugs, right? Drugs to avoid. Do you think that maybe in management we should avoid drugs? Yes.
Yeah.
Do you think that in medications we should avoid drugs? Yes. So we don't know. What should we do? Let's check. Okay.
And can it not be C because we've got 2A, 2B, 2D? Is it not?
You can look at the pattern if you want to be like that, like Dan Brown, Da Vinci Code or something. Let's try D. Does anyone see? So when you don't know, find a keyword, and you need to find that keyword now. So what word is a good keyword here to find?
Avoid.
Avoid using certain
Avoid.
types.
Avoid. Okay. Maybe you can have 2 certain types.
Certain types, yeah.
So let's all do this together. Does anyone see any language where they are saying, you know, do not give that?
No.
Yes.
Avoid.
Note that.
Yeah, avoid. Yeah.
But wait a second. This is saying avoid
Certain types.
drugs to avoid. Is this avoid drugs?
No.
Yes. Metro.
Yeah.
No,
Yeah.
that's a
No, it's about doses. It's not about
Dosage.
Okay.
Drug.
So we cannot be sure, but yes, this is the only time. What about here? Is there any avoid here? Or don't do it, be careful, watch out?
Just at the end.
It's about corticosteroids.
Yeah, have
Avoid the
not
use
been
of
successful.
systemic.
is limited.
Can you underline it, please, Mary? Where does it say?
Avoid the use of other systemic therapy.
Mm-hmm.
Avoid the use of other.
Yeah. So that is systemic therapy. I guess that's better than dosage. That would be a drug, right?
Sure.
Guys, the answer is C. The answer is C. But that's difficult. Okay. But usually in the exam, just to finish this class, usually 80% of these, 70 to 80%, you can do them really quickly if you have the main ideas. All right. There's always 1 or 2 or maybe 3 where you're not sure. Okay, you've got to check. All right. I'm going to finish here. All right. So I hope that you guys can come back tomorrow and watch the next class, because what are we doing next class?
Mock test.
We're finishing the rest of the
I mean, this is important, but of course, step 2 is more important. Okay, so tomorrow we'll focus only on step 2, and I'll show you how to find answers really quickly. Okay, I'm going to say goodbye. Thank you very much for all of your time today, guys. I'll see you all later on in the listening. Take care, guys.
Thank you. See you later.
Bye. Bye.